It feels so far.
See my name here? I put Jim the Hands Jones.
Yeah, Jim, don't be using that one.
Come on. Take off.
I did hear it when I took
I got all five.
You and your husband.
Number five.
Me and Ray went. We don't even, he didn't even wear a wig.
You like that?
Yeah, we're that girl.
And then I'm on number five.
Crap is this? Oh. All the same thing.
Josh, do you want this paper back? Who do you want to give it to?
Give it to Brett, is this in?
Black guy.
No, I look like a big goober in it.
Well, it says an emergency situation.
Cause she's like, no, I'm not trauma. The swimsuits are really tight, Mr. J.
Supposed to keep them upright.
The show. Maybe we come in Thursday and practice.
They used to be able, the doctor would get money for referring patients. The only thing that stuck out is the way the doctor does that right, treat you.
Jerry, you're doing this.
Patients they want to treat. Oh, they also have blood curfew service.
Okay, everyone got a list of the day. Right? Okay, and then that Thursday, Andy will be back at 1. And so we're gonna meet at 1 instead of 8 that day, so he will finish up that day. Your midterm for rehab will be Wednesday, and we'll probably not on the same test, but in the same time period.
So,
Next Wednesday?
Yeah, next Wednesday.
so we're gonna do what? Rehab? We're gonna do-
You'll do medical office management and rehab. Rehab midterm will, have like 30 questions off of that, will be spinal cord injury stuff,
How many?
30. The rest of it'll just be review from the other tests that we did on, the tilt table and pediatrics and, prosthetic orthotics. No, that's changed. We are not doing, we're gonna do Andy's class at 1 o'clock at our normal time and not at 8 o'clock because Dawn can't come that day anyway. And it was easier for Andy to do the regular time, so we're gonna do the regular time.
Okay, so then since we're treating, well, since I'm one of them that's treating next week, it'll only be on Tuesday. Will we do it Thursday?
No, you won't have to treat on Thursday, right?
Okay.
Yeah, anybody who's treating next week, Dawn cannot come on Thursday, so you don't have to treat on Thursday.
What about?
Who is treating next week? Okay. Tuesday you will treat 1 o'clock.
Instead of 8 to 12?
Yes, we're not doing 8 to 12 because it was better for Andy to do 1.
What time do we go?
Okay. We're almost through. Every experience, is that correct?
All the way.
You are going to, do you have that, lady's, office manager's name there? Yeah, try again. They know you're coming, I'm not too concerned about it, but, because we've just recently talked to them, so, yeah, you might email her and call her. Yeah. You realize you're 2 weeks out on that clinical, so I need them called today. If you have not made contact with them, me if I need to help you. I realize some of it's because they're not calling you back.
I'm getting a grade on the email every time.
I need everyone to send out their emails. I only have sending out an email with 5 objectives to your clinical the name that you have there. They'll send it to your CI if that's the CCCE person, okay? You guys, I can't get this to go on the overhead. I don't know what's going on.
Every day.
Alright.
Good.
The movie. I seen you at Sam's, by the way.
Like,
No,
Did you ever see that? I didn't see her first. It was cold, it made me.
yeah, I made that.
Cause I woke up with feeling ill.
Jenny was saying.
Yeah.
You guys can put me out so far. It was
That's
kind
one
of
of the
dark.
funniest.
And you were like, Jenny, you already know. Oh my
I was like,
God.
you go to the truck, she helped us stand by it.
I can't fill this voice, so if you wanna get out your computer, it's okay, or if you just wanna listen and look in the book. We're in chapter 6. And this starts on the professional liability and medical malpractice. And, I just think this is probably part of the really important part of this class is that you realize liability issues and things like that, and you don't want to, you just have to be really careful. And hopefully none of you will ever be sued. As far as I know, none of my students have ever been sued. But, and I've never been sued, and Bill has never been sued, but that doesn't mean it. What catches you with liability is it's normally, you can't cover everything perfectly. Some people are much better at it than others. But probably one of the most important things for PTAs to do is stay in very close contact with your PT. Every time something happens with a patient, at least text them, because it just shows that Medicare likes that anyway, but it's just kind of a requirement that you do that. If you have a patient that does anything that's real different, or a new, something, or if you want to try any new treatment, you need to contact your PT. Now, that's not always true. Like if it's, some of these PTAs that I've worked with Deanna Davis for 15 years doing home health. And so she's very good about calling me and telling me what she did, but she doesn't always call me and ask me. But we have that kind of relationship because we worked together for a long time. So, but as you develop your relationship with your PT, some PTs are very hands-on, and so you have to deal with that. They want to know if you put a hot pack on them. So you're going to have to realize who those people are. I do not want to know if you're going to put a hot pack on them. But, some people do, and so, I've had some of those PTs that are very hands-on with their PTAs, and it's not always real fun for y'all. But just be aware that was not someone that they could trust. And so sometimes that happens. You have to develop trust with your PTs. And so that's a very important relationship for you to realize. And hopefully you will never get into a situation where you can't have contact with your PT. That's really what happened that put all of the supervisory rules in the state of Oklahoma. Is there was a PTA in Muskogee who actually documented minutes that they did not do, And their defense was that the PT was not available for them to get in contact with. Now, does that have anything with committing fraud, that the PT was not in contact? So you don't ever want to do that. You do not want to document a visit that you didn't do. I mean, y'all you just don't want to do that, right? You don't do that. Another very important thing is that you make sure your dates are correct. Yes, and so because of that, do you think that's a good defense for this guy?
No.
No. And the crazy thing was, he only lost his license for about 6 months. I was angry. And I do think he probably had to go on and face criminal charges because of what he did. I don't know, but the state of Oklahoma, at the Oklahoma Medical and Licensure Board, only took away his license for 6 months. And so that was crazy to me. Quite frankly, I'm not sure he shouldn't have had him taken away forever.
Yeah,
You know,
but
that's kind of the way I am.
Was anybody willing to hire him after that?
Probably not. He probably had to leave this, and I don't know if anyone would ever be willing to hire him.
Yeah, 'cause it
I mean, I would think he had to, I don't know, I'm assuming he went on through criminal, obviously he did that, and I'm sure he was brought up on criminal charges. But anyway, so that's when the state of Oklahoma put in these heavy supervisory rules where the PT could only oversee 3 PTs at a time, or else be in a group setting where you can do some others. Some other things is that you have to do a one-on-one visit with the patient every 3 months. That's a big pain, to be quite honest, it is. And some of that, though, is because, do you think that one visit every 3 months, if there was problems in communication, do you think that helped it at all? It doesn't. You either do your job or you don't. You know, them putting in all these little rules to make you jump through the hoops, if people are gonna commit fraud, they're gonna do it anyway. You see what I'm saying? It's just, I don't know. I get upset about all that, all the rules and where they're tying you down. But anyway, the nice thing is that in the state of Arkansas, you don't have to do that. Most of y'all will probably work in the state of Arkansas. So Arkansas had not dealt with that so much. But anyway, that's how that all kind of came about, was because of that PTA in Muskogee doing that. And it was just kind of crazy. But what happens sometimes in home health settings is you do have PTs who are not in good contact with their PTAs, because I do some work for ViaCare, which is a Stein facility, and I have to make an effort to call my PTAs and communicate with them the whole time. Where I personally think a PTA should be calling me. That's the way I feel about that. But I do that with that team because some of them are my students, and so it was, you know, I established that with them, because I may do I did like 3 patients this summer for them, and so I had to really work at communication with them. But normally that's not the case. I'm in close communication with my PTAs all the time anyway. So hopefully you will have one. You may have to force that relationship a little bit. It may make you decide to go to work somewhere else because you have a PT that won't, you know them or not, they need to be in the loop. It's just very important. On chapter 6, let me try this one more time. I just don't know why this isn't letting me do that. With the liability on your, whenever you're dealing with malpractice, if the patient did not receive an injury, then there's not any to you, and nothing really happened to them that hurt them, but there might have been malpractice. While people have always been responsible for their actions, the courts are now finding that everyone associated with negligent actions is liable for damage. What does that mean? If in a hospital a nurse does something and there's an injury, or if a PTA does something and there's an injury, then not only is the PTA responsible, but the PT is responsible. Sometimes the doctor's responsible and the hospital is responsible. So that's the new thing, and they've been doing this for a number of years. But so your PT is very liable with your care, so be aware of that too. And I've only had one experience where I had a PTA that I did not trust, and I ended that relationship pretty quickly. I take that back, I had two. One time I was covering at a nursing home for a girl who was not one of my students, by the way, she came from somewhere else. And I covered for her for a week, and it was at Spiro Nursing Home, and I got in there, and this girl could write the very best notes that you have ever seen. It sounded like she was doing great things with these patients. I got in there, she wouldn't even get them out of bed. It wasn't that she was lying, but she mainly was doing things in the bed. My first clue should have been that when I met her, she had on 3-inch heels and a short skirt. It's a little hard to do that as a PTA, working in a clinic. And so I turned her into her company, and they no longer utilize me. So that made me mad. I did not turn her into the board, and I don't know how I could have done that. But I did turn her into the company, and all that nursing homes are in there. I don't know if you've ever been in it, but it's at the old hospital. And it's awful looking up at the old hospital area, but they had CNA. Some of them have been there for 20 and 25 years. And it was run by a lady for 20 years. It was like a sergeant. She was an LPN, and she was great, because if you weren't taking care of her patients, she would tell you. So when I walked in the door, she had all this stuff she was telling me about this PTA. But anyway, it didn't turn out in their favor, although they did get out of bed that week. The patients did get out of bed that week. It sounded like they were not capable of any of them walking. And so a lot of them, I had them out of bed walking them down the hall, and she wasn't ever getting them out of bed. It was weird. It sounded like they could only do sit-to-stands at the bedside or stuff like that. Anyway, it made me mad. She was not doing her job. But she could write good notes because I read them. Malpractice is professional misconduct or demonstration of an unreasonable lack of skill with the result of injury, loss, or damage to the patient. So it is a professional misconduct. So it's usually with on-job and patient care with an unreasonable lack of skill. So if you are expected to have that skill and the knowledge of what you're to do in those situations, and there's an injury because of something that you did or did not do, then that is malpractice. Negligence is when there's an unintentional action. You didn't mean to do it, and usually most malpractice is that way. You don't set out to hurt anybody. So it occurs when a person either performs or fails to perform an action that a reasonable person would or would not have committed in a similar situation. So negligence and malpractice. Negligence is the act. Malpractice means you're probably in legal trouble. Fee-sense, this is all on your PowerPoint, by the way. Fee-sense is doing an act or performing a duty. It's F-E-A-S-A-N-C-E. And there are 3 ways of looking at that can lead to malpractice. Malfeasance is performing a wrong or illegal act. So that's when you actually set out to do something illegal and might hurt somebody, maybe a criminal, maybe you hit a patient because they made you mad, something like that, malfeasance. Misfeasance is improper performance of an otherwise proper or lawful act. So it was improperly done. That would be misfeasance. Non-feasance would be failure to perform a necessary action. For instance, someone got burned on a hot pack and you did not give them a bail. That would be non-feasance. Any other example y'all think of?
So then non-feasance is like neglect and malfeasance is like abuse?
Malfeasance would be like abuse, yeah. I mean, you kind of set out and it's a legal thing. The 4 Ds of negligence, and you have to have all 4 to do that, and there's other ways of doing this, but realize you have to have these 4 things for there actually to be a malpractice. The duty, remember we talked about duty in another chapter. You took on their care, and that's considered a duty. Dereliction of duty is the PTA failed to provide a correct standard of care for the patient. So you did something wrong or did not do something. You did some kind of malfeasance, misfeasance, or non-feasance. And where the standard of care would have required you to do the correct thing. So there had to be a dereliction of duty. Direct cause.
Is that like neglect or?
yeah, it would be neglect or something you did that caused them to say that you hurt me. Whatever that would be your dereliction of duty. Direct cause, they have to prove that the breach of duty was directly caused the patient's injury. So you have to have some kind of connection there. You turn the ultrasound up too high and burn them. You put the patient on a therapy ball and you did not have a gait belt on them and you were not guarding them correctly and they fell and broke their hip. Then damages. Again, you have to have injury for the patient. Injury caused by duty, dereliction of duty, direct cause, and damages. Remember that the standard of care is what PTAs are doing in this area, how they treat patients, determined according to what members of the same profession would do in a similar situation within the same geographical area. So that's your standard of care, what that would be based upon for your duty, basically what your duty is.
Is the geographical area just based on, because of the state standards?
I think so. I think that PTAs function very differently in the East. I don't know. I think there's a lot of freedom for PTAs in this area that you would not experience in Maine or Boston or there. It's just real different. So you have to. I've often thought of that. That might make a big difference. But again, you're looking at. I don't know how. I've never looked at the Practice Act for PTAs in Massachusetts or Maine. I probably ought to do that because I have a friend that works in Maine. She used to work with me in New Mexico, and it's very different. She doesn't work with PTAs up there, and I just don't. I have never really looked at the laws, but it's very. She's always surprised I'm working at a PTA school because they hardly have them in Maine.
So one of my aunts, she's a physical therapist up in Wisconsin, and she's surprised that there are like so many, like, that we have contact with the PTAs and stuff.
Right.
It's like they don't even see.
So they don't have PTAs that work even. So there may be some states that don't allow them to do home health because they're out on their own. I don't know. So. Fraud. The next one is fraud. Fraud is the deliberate concealment of the facts from another person for unlawful or unfair gain. Some of the things are illegal billing for services. That would probably be the biggest one that we probably deal with. The Oklahoma Medical Licensure and Supervision, they send out a quarterly. The PT board sends out a quarterly that has all of the people who have been brought before the board and their names and everything, and it's always interesting, and fraud is something that's it's probably the most common thing that I see there. Sometimes it will be DUIs. I saw one of those recently. Sometimes it will be with drugs or whatever. Sometimes they're involved in some type of drug, it's some kind of criminal thing. Yeah, they would probably take you, the state of Oklahoma is really bad about, they take you before the board no matter what.
Like, did they do it for like speeding and?
No, they wouldn't do it for speeding ticket.
Okay, so like no traffic.
Too much trouble
No,
for them.
no, it would be traffic. and things
What
like
Stephanie wants to know is, what can she get away with and not be brought in front of the board?
Well, I
Probably
learned that if I
traffic.
put butter in a sock, I can get away with anything, it doesn't leave bruise.
But you didn't hear that.
Butter in a sock?
Yeah. She thought.
I just love that she.
I would think domestic abuse would probably pull you in, because it's becoming such an issue. So I think that they probably would do that. Dishonesty when conducting medical research, kickbacks for making referrals for Medicare and Medicaid patients, which would be a physician thing. That used to be a big deal. When I first got out of PT school, it was very common for physicians used to own PT clinics. And Medicare will no longer allow services to be done in a physician-owned clinic. And so a lot of those clinics had to change out their ownership, and probably the physician still in the long run owns it, somehow still gets money from it. But you don't see, because they would just refer to their clinic, because that's where the money went. They got over-referred. I mean, the research showed it was over-referral. And then, of course, embezzlement is always fraud. There's a lot of embezzlement that goes on around here. I always think that's interesting. Poor Marvin's, I think Marvin's has been embezzled from many, many times. Medical tips. Remember that every person has the ability to say no when asked to perform an activity that is unethical, illegal, or against his or her own value system. You are responsible for your license, and you have to, if someone asks you to do something that's unethical or illegal, for sure, you don't want to do it, right? Probably the biggest thing that we saw in the last couple of years is when they've done all this changing with one-on-one billing in skilled nursing. So you just need to be aware of that. That's probably the biggest area, just kind of, kind of watch that. It is easier to prevent negligence than it is to defend it. So we want to prevent it as much as possible, right? Remember that ignorance of the law is not a defense. Like if you came up and said, well, I didn't know it was illegal for me to bill, I have 2 patients in the clinic and I'm billing them as individuals. I didn't know that that was the case. They don't care about that. And that's true in all legal situations. They require you to know the laws. And so they don't care if you don't know. They just go ahead and put you in jail.
Okay, on the little first bullet you have, like whenever I did home health this summer for a little while, I still had my Med-Aid license. One of my patients that I was seeing her medicine, like I got it out of her bag and handed her the bottle, and they said that, they had to give me a warning or whatever because I wasn't even allowed to touch it, according to their company. Is that something that you can get in trouble for, being a PTA also? Like handing them their medicine or helping them sort it out or doing anything?
I probably would not sort it for them. I think you can hand them a bottle if they, out of there. I've never heard of anything. I think your home health agency had a control person that kind of went overboard. That's my personal opinion. I would like to see if it was actually something that was written into their policies and procedures that your CNAs or CMAs would not hand any type of medicine bottle to somebody. How stupid is that?
Well, whenever I worked there, they didn't use CNAs, it was just a PCA, and so, you didn't have to be licensed or anything. But because I had to write up a statement about an incident that had happened with the woman, and they had to drop her from that company, I had put down on there, that I had handed her a bottle of her medication, and they said that they had to
They had to do, that's because you had it written into the statement, and they had to react to that maybe. They were
Yeah.
worried about it being an issue, because it was already,
Yeah,
already
they said
letting
that I
them
wasn't
go.
allowed to, do that to anybody or anything.
I wouldn't want you to, hand them their you could hand them their medicine that's already been, put into the little pill boxes. You could do that, but I wouldn't want you to put the medicine in the pill boxes for them. That's really nursing, to do that. But I don't know why you couldn't hand it to them if they were independent in taking your medicine. So I think you would be fine in that just as long as, I think the reason why they did that is because they had documentation and there was already an issue with that patient. They just wanted to cover their butt all the way around.
Maybe because the patient was known for taking the wrong amount of pills, or,
Yeah, I'm guessing that it was,
maybe popping too many at a
yeah,
time.
they just didn't want
But
to
how would
see.
she know?
When you do an arbitration, normally you'll have not judges, but lawyers that, you may have 1 or 2 or 3 lawyers, and the 2, like it may be a workman's comp case, and so the workman's comp company and the defendant or the person states that they will, whatever the decision is brought down, that they will accept that. So that's an arbitration. Issues a binding decision about after hearing both sides present witnesses and facts or evidence relating to their case. Both parties must agree ahead of time to accept the decision. So it's submitting a dispute to a person other than a judge. And they try to mediate all kinds of family court stuff, and I would assume that would be an arbitration. But a lot of times mediation is not legally binding. They just try to help set that up. Or an arbitration, if you'll turn to page 152. I wanted to read part of some of the cases that we've seen before. Just, I think it's interesting, and Again, once you get licensed, I think Arkansas puts out a quarterly also, but if you'll read all those cases in there, and your, once you also get liability insurance, they'll send out different cases that have come up, and it just makes you a little more careful. Makes you a little more aware of things you need to write in your notes. And anytime you think there's an injury to a patient, you need to cover yourself very well. And also, you always write an incident report. So anytime you're injured or someone is injured in your clinic, you need to write an incident report. An incident report is separate from your notes. An incident report is within the facility. It cannot be subpoenaed even. It's something that just is within the facility that's very specific. Nursing assistant, down on page 152. A nursing assistant in a Mississippi nursing home is attempting to lift a patient into a whirlpool bath using a hydraulic lifting device. The seat on the device became disconnected, causing the patient to fall and fracture a hip. The nursing assistant was found negligent for improperly connecting the seat to the lift device. So that's, you could see how that would be the case, but where the nursing home would have to prove is that they had actually trained her to do that. I'm sure that was an issue. And so that's why with nursing homes, there is so much in-service training and documentation, because there's a lot of people who own nursing homes, they deal with litigation continuously. They probably have 5 or 6 cases going in all the time. So it's a really sad thing. And then that nursing home, it's just a mess. Another thing that you remember too is anytime equipment is not working, you never want to use equipment that you think is not working correctly, because if the patient is injured, then it's immediately a liability. Anytime equipment is not working correctly, you're liable. Here's a physical therapist. And I think this one's interesting. A PT who refused to allow an 82-year-old nursing home resident to use the bathroom before beginning a therapy session was found to be negligent. The therapist appealed the disciplinary process in the nursing home. The state Supreme Court ruled that a nursing home has a policy of allowing patients to use the bathroom when they wish, and therefore the therapist was negligent of the patient's health and welfare. So what if you have a patient that has to go to the bathroom 14 times during your treatment?
You have to take them, because it happens.
Yeah, it does happen.
We had to do that.
And sometimes they really do need to go, and if you don't take them, they're going to pee
Oh,
on the
yeah,
floor,
and
which
you
has
wouldn't want
happened
that, yeah.
when I was in
Or on
therapy.
your shoes.
So, yeah, I mean, it's, I wonder what, probably the thing that you always want to remember in litigation, if you're in the wrong and you bend over backwards to take care of that patient, they're probably not going to sue you. Yesterday I did about 6 evals at a leak, because I was supposed to do them on Monday and Tuesday. I had 6. I had a lady that ended up waiting an hour for me. And I felt really bad. That's very rare for that. That just happened. And so I went in there apologizing the minute I walked in the door. I needed to get on her good side because she was not happy. And so I bent over backwards to make her happy. And I really did that specifically because could she have sued me for sitting there for an hour? Probably not. She wouldn't have done that. But I wanted her to be happy and walk in and see Pete Safita tomorrow and be a happy camper. So see, you do those kind of things because you know that you actually were in the wrong. And so that's true with liability. If you burn somebody, what do? You ask them to come back to your clinic and take care of it and make sure that it's, dressed. You wouldn't go to their home, but you call them and check on them and make sure that everything was taken care of. If you do that, they're not going to be as apt to sue you. If you show that you don't care, the people who get sued the most in physical therapy are physical therapy outpatient clinics that are sometimes. And so you always want to, even if they're a wuss and you think they're just a big baby, if there's something that happened where they were hurt or had a shoulder injury because of, if you ever injure someone because of doing, range of motion with them or something, you need to check on them consistently. You don't want them to sue you, and especially if you were in the wrong. Sometimes you hurt them. You may, example, my brother's mother-in-law had a rotator cuff repair, and they repaired the biceps tendon. She had a physical therapist who was gone for 2 weeks, did not look at the chart. She was still under rules not to have any weight on that shoulder for rotator cuff. She was about 2 months out, but she was still specifically stated in there not to use weights. And the guy handed her a 4 or 5 pound weight. And she should have known better herself, but she thought he knew what he was doing, and he pushed her to do that, and she tore that biceps tendon 2 months out. Now, she did not sue him. I don't know how I'm guessing he just couldn't believe he'd done it. He'd just come back from vacation. He did not check the chart. It was a horrible thing. She's still in a lot of pain in that shoulder when I see her. So, you know, those stupid things happen. So she could have sued him. She didn't. She's not that kind of person. But it was just one of those things that can happen anywhere, right? We can get the wrong chart and do the wrong thing. I mean, we don't want to do that, but it is possible. So you have to be very careful in those issues. Respiratory therapist down at the bottom. All healthcare professionals are required to report unusual situations to their supervisors. If they do not, they are negligent in their duties. This goes back to making sure you talk to your supervising PT. In an Indiana court involving an inhalation therapist and a nurse, the court found the two negligent in failing to report to their supervisor that an endotracheal tube had been left in a patient longer than the usual 3 to 4 days. The patient suffered injury from the tube and needed several surgical procedures to remove scar tissue and open her voice box. Subsequently, the patient required a tracheotomy to breathe and was only able to speak in a whisper at the trial. So that was the negligent thing. They accidentally left that in. What's something that happens in the hospital a lot that I see? They leave IVs in too long. That's a real common thing. People will have issues with IVs. So how long is an IV supposed to stay in?
Yeah.
I'm thinking no more than 5 days, 4 or 5 days. And sometimes they're working well, but you still have trouble with them. I've seen them where the whole fluid goes up underneath the skin. It's a mess. You know, I've seen some real bad things happen because of IVs being left in.
If they're doing something like an antibiotic treatment that's like, 6 weeks with the antibiotics or, do they have to change the site every 5 days?
I think so. I think they do.
Yeah, I haven't ever seen them do that. It's always just left it in for.
Well, and if they're doing some real, handle a lot, they're a lot better than they used to. Tip, remember, and I think I've told y'all this, that you must identify yourself with your name tag on, but also someone, you always have to identify yourself as a student physical therapy assistant, okay? Make sure you put that assistant in there. That's law. And then there's some things on page 155 and 56 on just some general guidelines for to avoid. Always act within your scope of practice. Make certain that all staff have a clear understanding of what conduct is unlawful. Provide in-service training on what is meant by standard of care and professional conduct. Do not make promises of a cure or a recovery. That's a real common problem sometimes. Treat all patients with courtesy and respect. Unfortunately, some patients tend to sue people they do not like. And sometimes people just set out to sue you. I mean, that's really true. I mean, that just happens. Avoid having patients spend more than 20 minutes in the waiting room. Explain the reason for any delays in treatment. Always carefully identify the patient before beginning treatment. When a patient identification bracelet is available, use that. And they're doing that in hospitals a lot more now, aren't they? For surgeries and things.
They ask you who you are and what your name is.
So if somebody like tries to take the baby or steal them, like it will walk down the doors and the elevators and everything, so they can't be taken. It was really neat.
Oh, because you hear these hospitals that have had babies stolen. Never attempt to provide care beyond the scope of your training or experience, and that means, there's a lot you're not going to want to do. So make sure that if you're not comfortable doing a treatment, if you're not even good with that type of a patient, then you don't staff. Do not criticize other staff members or your employer in public areas where patients can overhear your comments. You don't want to do that. That's part of your doing that. And then there's some safety things. I wanted, on documentation on page 156, remember that you prepare an incident report to document any unusual occurrence that happens in your clinic. So you always want to document if you have someone hurt, or if you're hurt, or a piece of equipment is used that shouldn't have been used. You still want it all documented and written down, because what happens, remember that litigation, sometimes it can go on for 3 to 5 years. You won't even remember. The one I did once have to give it wasn't a subpoena, but they came from Albuquerque and talked to me, and it had been 5 years since I'd seen that patient. The only thing that saved me was that we were taking pictures of patients at the rehab center then, so I could remember him. He was a head injury that, I think I told y'all this story, but he fell out. He was drunk, they were all drunk, and they rolled one of those vehicles that like set up real high, and it was real easy for them to roll, flip it. So they were trying to sue the company, the truck company. I don't know how they could have done that, but they did. I mean, I don't know, I had to give what's it called, deposition. It was a deposition, that's what it was. They came down for that. But I did not even know who it was. You're not gonna remember what happened, or even why you would possibly have to go to court for them. These are 2 more in there. Do not, never alter the medical record, make any corrections by using the acceptable method of drawing a single line through the error, write correction above the error, date of the change and initial it. Sometimes they don't put correction up there, they'll just maybe date it and put your initials. Wherever you're at, you need to do that. Of course, everything's being done on the computer pretty much now, so that's even different. If using an electronic medical record, make corrections according to the standards set by your employer. Do not delete or alter what another person has charted, even if it is clearly incorrect or what you have charted. You don't want to ever delete anything. What you do is you go, if you need to clarify anything, and then date the addendum separate. You don't ever go in and erase or anything like that. And y'all know that, I think. Okay, I'm through today.
Hey, what'd you go to last time?
sure?
I don't know.
But
4:30.
it is being seen
That's
definitely.
probably.
I don't remember him saying anything.
I guess it's gonna
He
be.
hasn't said anything, but on his schedule.
Even though it doesn't say LPN in there.
Surely then,
But we haven't reviewed for him. Have we even put the test? No, we just didn't put it.
So organized, it kills me.
I know, I hate it.
I'm so confused now, like, I don't know what's due when, like, I'm just.
I'm really scared.
I still haven't taken Kendall's last quiz. 'cause
You
he
got
hasn't
your
come back
medals?
up.
Those are awful. Yeah,
His
the treatment
questions.
session. Yeah, the checkoffs. First of all, those are live treatments. So.
I can't pretend to be an eight, but
Maybe Thursday, how do you get your marshals on?
and I can't pretend to be paralyzed, so you're gonna walk me. I'm just gonna go on YouTube and start watching.
They can't fit your cell, all of us.
True that, especially now.
Jane sent me my picture.
Those number pictures from yesterday.
My face was so red. Hey, have you went and saw me yet?
Again?
I've saw him twice.
Have you really?
Yeah.
We're like that.
Well, my sister wanted to go, and so we went Sunday, and then she went again. She liked it so much, she went again.
7301 Roger.
Don't judge us for these.
No, I read all three of those.
And they're so good, aren't they?
Yes, it's very
And I'm
good.
embarrassed when I tell people that, because people are like, you've read something like that.
First of all, it's people who've never even cracked them open, so they don't even know what it's about. They just assume what it's about.
Did you like
I don't
the
know
movie?
about.
Cause I've heard a couple, oh, girl, you gotta read those.
What, who'd you say?
Then I'll just be disappointed.
Jenny read like.
You won't be disappointed.
Well,
Your
Chap-
imagination,
Jenny read a
believe me,
chapter
you
into
can-
it.
He might be disappointed in real life.
Yeah, that is the downer.
Yeah.
But did you like the movie?
Yes, it's very
I
good.
heard a lot of people are like, this is good, but it's never as good. You just
It's
kinda
never as
lower
good
the
as
standards there. And they're like, well, they left a lot out, and I'm like, well, they kind of have to.
I've only got into it
So,
for
I mean, just take it and just go with it.
But like the parts that all the parts that they did put in, it was pretty much exactly like the book. So they didn't change what they say and everything, but it was pretty. I
And then my mom texted me the other day, and it's like Magic Mike XXL is coming out in July.
They showed that preview in our theater and like everybody was catcalling and like.
My mom and one of my good friends, and my mom was literally lit like a, you don't even know, 10-foot fire. And the part where
Right.
telling this
I'm gonna think that next time she cashes my check.
okay, don't tell her. She can't know that you know that. She'll be so embarrassed.
Just go in and cash your
she's
check,
wanting to
oh my
tell
God, is it hot in here?
Oh yeah, well, my mom, she was like, I'll go with you to watch 50 Shades of Grey, and I was like, I'm not going with you, Mom. No offense. I'll go with you to any movie except that one. That's just weird.
Just me and my mom are just, which there's not much of an age difference, but we're just, I'm always with my mother.
Yeah.
Wow.
Yeah, I definitely will.
My grandma's got, some of the things my grandma's, I'm like, I don't know. But she's only like 50.
My Mimi is 56, I think. My mom's 39.
Yeah.
So, yeah. But my mom and my Mimi went and watched The Wedding Ringer with Kevin Hart in it.
Yeah.
And so I really want to go watch it. My Mimi said it was hilarious. So I love Kevin Hart movies.
Do you love Kevin Hart?
Yeah.
He's in Oklahoma City, April 11th.
Okay.
at 8 p.m.
So his woman was like way taller than him. Yeah.
I think anybody's way taller than
I
him.
think he's like 5'2".
He's
He's,
like a short black guy.
he's hilarious.
I told my sister, I was invited to a wedding, I would go. And she was like, you don't like his cousin? I was like, still funny. I have to go all the way to Wisconsin in September for a wedding, for a weekend. And I really dread that drive. Steven is already talking about it. He's like, I'm flying. I was like, well, you can fly.
Did you hear my daughter getting married?
I mean, I know what it does to me when I fly, like what it does to my ears and everything else, and it was uncomfortable for me. I couldn't imagine.
Well, I just don't want to fly.
I wouldn't have any
Desire to fly. I've never looked.
I know.
I had like 6 times.
I just don't.
Cause back before when I was single and didn't have kids, I went.
I gotta ask you a question.
So,
I like Brady, he's really cool.
This summer?
Chicks are good.
Courtney, you working with
Like
her?
your one coming up?
Grandson, and he's a hard worker.
I
Guy
guess
works 7
she
days a
talked to
week.
the lady, and then the lady had her baby, and then.
You know, not around much, but he
I don't know.
puts food
So
on
they
the
were like,
table.
What's he doing?
He does pools, swimming pool, you know, concrete work. That dude works.
Well, last fall.
That'll pay off and maybe you'll be.
You know how hard it is to get through somebody at Health South?
Well, I just bought my daughter a
supervise.
computer.
And that lady, I think,
So she can
she
start going to
put
school.
Kayla Edwards on that.
So,
For mine?
So the lady to call you, like on a piece of paper, in like 3 months.
so she should.
She, actually, no, she hadn't worked there in a year, cause she's been over at ABF, cause I remember when she worked there. Oh my
She hadn't been there
gosh.
in a year, so I don't know why she's
Well,
for sure not up to date,
right here, it says.
cause I know her.
Okay, on mine, first of all,
Well, I
I'm on
can do it.
the outpatient card, and it says,
An old
has
card
the
like
number for
me,
inpatient
you could
and
do
job A, that translation.
She's really cool. The PT that I worked for in Greenwood, she worked at
I go
Health South
like I am
forever,
right
and her
now.
and Job
Go.
are like, they turn out.
I don't know what I.
So they are like they don't like us to be there at all. And she actually told her that
I
she
just
told
read all the
Lisa, that's the PT
information
that worked
instead
for,
of
that she
writing it
worked there.
down on
She was
cards.
teaching me
Cause
something.
I already had it
because
written
she
down on
was
cards
teaching
from
me
last
something.
test.
And so
So
Right.
I went over all them cards again.
Awesome, thanks for that.
And
That's why I didn't want to
got
go.
everything.
Huh?
Are you going to Health South?
PTA.
Very-
Great,
That's
So,
why I didn't
it's
want
gonna be my
Right now,
second
Chapter 6 done.
hard clinical, awesome.
Chapter 7, I got 10 left.
How are the outpatient? What his brother said. Maybe it's just the inpatient, I don't know.
our patient they were just nobody wants to do this.
For some reason that just reminds me of Jen.
Are you serious?
Yes.
That reminds you of me?
Yes. Hang on.
She working it?
Yes.
Really?
That's exactly me.
She's
That's when I
kinda,
first tried to get the phone, to answer the phone.
well, yeah, and
I
for
was
lack of a
going,
better word.
God, I was touching it.
I didn't know if you
So,
could get
Mitzi
pictures or I
always
would have
just
sent you
nice, has
all the
nice
pictures
stuff.
of it's anymore 70s.
Like the labs and stuff, but I didn't know if you could get pictures now.
Well, I think I can. I know I got
Think
Instagram.
you can, you can do it.
What are we supposed to do this hour?
In the 20s.
Whatever.
He said
Yeah.
work on
Yeah.
section
Yeah.
objectives for the spinal chapter. Think he can start taking pictures of his food or something?
I got a picture for you.
She's always on the phone.
Which one do this? There we go. Look at that. That's me, my dad, my brother.
Little troublemakers, which one?
Man. It's a tough son of a gun. Look, check it out.
Usually.
Me as a little.
That's just,
Who knew
that's
that
too
little?
sweet.
Hey,
They want some jungle juice.
I've had jungle juice.
When you woke up naked and 3 counties over in
Doritos.
the middle of the feast.
I don't want that. I do not want the apple
Do
E.
not want it sandwich.
Nice, a lot of orange.
So you're the
juice,
one that gave it to me.
Mango.
Trying to drink water.
Dang.
No, I'd be drinking water. I brought one in from my car.
Good Lord.
Someone's gonna get.
That's why I got it.
Choke up, and float up.
Gonna be some drunk people that are mad.
Four peach schnapps.
There we go.
Maybe I should make that for my daughter's wedding. She's
And
gonna.
then how many orange juice?
You know what? After all that fruit sits in there, you start eating the fruit.
Oh, yeah.
That's when the real fun
Look at
is.
this. Oh, wait a minute.
It's okay. It's because it needs to be,
This means-
that's your dad?
That's my dad.
Which one is he?
Yeah. And my little brother.
That's when the real fun starts to start eating the fruit.
Yeah, I have
I wanted to show you Jacqueline's hair.
Is it blue or
It's
purple?
blue on one side and purple on the other.
Oh my goodness. What? Was she gonna fight me?
Well, she just, that's what she wanted to do.
Where'd she get it done?
At, curl up and dye and
Curl up
stay
and
with-
die.
What is it, blue on one side, purple?
Purple on the other.
Is her hair naturally that white?
No, her hair's like blonde.
Naturally?
It's like, well, strawberry blonde.
It looks good on her.
Plus she got her tie-dye shirt on.
Yeah.
Friggin' hippie.
Well, Jim, you guys gotta have something in common.
Oh, yeah, I'm a hippie with short hair. This here's my practice pictures. Just a cup on the table. I just wanted to make sure I could make it work.
I think I was in the thing with you.
Oh, here's one I got for me.
That's crazy.
Yeah. Gave that to Jacqueline on Valentine's Day.
Is it a girl or boy?
A girl.
Do people ask if it's, because my Sophie was just like that, and they're like, is she part people? And I'm like, no. She just says colorblind when I get
Yeah.
this.
Well, if anybody knows anything about chihuahuas, a lot of them look like that.
Yeah.
Dog drives me crazy.
That
I've
dog
saved
goes
it.
everywhere I go. I look down, she's right there. And you're like,
That's the way it is with Jacqueline. With me, the dog hates me.
she don't like you?
No.
So what chihuahuas do that?
I've saved that dog's life twice. Pulled her right out of the mouth of the dog. This dog was just chomping on her, and I grabbed its mouth and ripped it open and pulled the dog out.
She's still not grateful.
No. I feed her. She sleeps in the bed, and her and Jacqueline take the whole bed up. That little chihuahua takes up a lot of room. She gets on the blankets between us and sucks the blankets down. So Jacqueline, every time she rolls all night. And she rolls and she keeps pulling the blankets, and I end up with no blankets at night all the time.
That's where you just put another blanket down on the floor beside you. When you lose that one, you just pull that one up.
Well,
That's exactly what I do.
do you?
I do.
That's what I guess I'm gonna.
Because Rustin takes all the blankets. He's a blanket hog.
I mean, I even get near Jacqueline. We're laying in bed and the dog's like right there, and I go to put my hand on Jacqueline. Still, she's had that dog for years and it still does that. I walk in the bedroom and that dog will start
When
growling
we
at
first
me.
got our chihuahua, he would do that. She would do that, and every time she did that, slap her in the face.
I was thinner then too. I
No,
can't
but
even wear
really,
that shirt now.
I knew you would.
He really did, he would really try to
So
start.
what's that there?
You know, but they connect with her.
Doing all right today?
I am reading.
Is it on my email?
Doing well.
No, the kids can't even sit down by me if she's in the house. We'll probably just like
And so we would all, every time she would growl, we'd slap her in the face. Not hard, but just, on her nose. And she quit doing it.
Well, it should be, if like when we were out at night, we go to crap and everything.
Is that the name of a car? Oh, that's Bernada.
But if she's in her cage, she won't go back.
She don't even know what that is, huh?
I do.
The reason we have to say it, I don't know
Bernardo's
why,
used
but
to
you say,
come-
Sophie, go
The
lay down
8-hour
froggy.
warn.
She goes and gets
No,
it.
that's Bernada.
Oh.
So you're like, okay, go ahead.
Bernada's were,
I don't know what
they're
froggy is.
pieces of crap. What else do I gotta do? So, that's, we're gonna have the rehab and the medical at the same time. Are you serious? God,
That's malpractice.
that is, I'm not even gonna say what that is, but you know what it is.
Just think, we were doing neuro and Therex, one, and all that at the
upset about it now.
We're actually getting a little bit of spoon feeding again this semester. It's kinda nice.
Yeah, it has.
It's kinda fun to be in spoon fed.
I know, like, I didn't do anything this weekend. It was so nice.
I didn't do anything last
Until
night.
somebody,
I was like,
Tara texted me and was like, hey, we have a quiz Tuesday, right? I was like, oh
Yeah,
gosh,
I
that was Monday
studied-
night.
I
I
studied that
studied a
Monday
little bit
night.
I was
Monday
like, thank
night.
you so much, yeah,
Big
that's
deal.
me too.
Yeah, but you
I was
remember,
like, thank you for
like,
texting me.
yeah, you remember how bad it was last semester, and like on the weekends now, you just like,
Don't do anything.
don't
I was
wanna do
just glad when I
anything.
didn't have
I
to go
know,
to the
I just leave
library
it in
on
my
Sunday.
car. I'm like, okay.
You guys are really pissing me off right now.
Why?
I spend the whole, I don't remember anything anymore. I think last semester totally fried my remembering part of my brain.
It's like, yeah.
I saw some sparks.
Well, it's maybe the smoke from the past, that's what my problem is.
Different types.
Hey,
Yeah.
Jim, I can argue that.
She's right there with you.
Ah,
I must not have smoked as much.
well, he didn't smoke near as much as I guarantee you.
Jim had a good 4 years though.
I mean, my dealer was right across the street from my house, and so I had that stuff constantly. And that
That was just
wasn't,
recreational.
I got up in the morning, that's the first thing I
His was
did. When I went to bed, that was the last thing I did. I did that for like 20 years, but I can't remember the date I quit.
Can't remember.
Can't remember why you quit.
Which I regret, and it was, it gave way to me all kinds of crazy stuff. I got 10 years of my life, I don't even know what happened. I know I ruined a lot of stuff.
I just thank the good Lord that I didn't have an addictive personality, because I was.
Well, see, I have a personality. That's why I'm so fat now, because I don't do nothing else, but I gotta do something. I don't smoke, don't smoke, so,
So now you just wanna eat.
yeah, I eat everything exciting.
He's trying, bro.
Oh, he didn't move around.
I had to push him out my way.
Who?
Oh my god, really?
Oh my God, that's not even what I was talking about.
Oh,
After I joined
I mean, that too, but.
You're like, well, that is.
I was like, it's not a big deal.
Yeah. Why don't you do that?
Okay, ask me any more questions.
Why don't you mind the double?
Carrie laughed tonight in the background. It's like, she's like, ah.
I watched that James Brown movie,
Get on up.
Get On Up.
I haven't seen it, I'll watch it though.
It's pretty good.
I like a lot of James Brown music, that's
Yeah.
basically the only reason why I wanna watch it.
Yeah, I mean, it was, the music was good. I was tapping my feet the whole movie, or whole movie. It was pretty good. I think they portrayed him as a better person than he was, though. Hey,
What?
I think they portrayed him a better person than he actually was.
No idea.
They never showed him drinking or nothing. Well, I ain't gonna tell you no more, cause you're gonna watch it.
I don't care, I'm not one of the people that get upset about spoilers.
But it was pretty good.
Actually, half the time spoilers.
You did a good job. Oh, yeah, I love that movie. He did a great job in there. Yeah, I like that movie a lot. It's on my DVR so I can watch it again and again. But, I I just saw American Hustle the other night. You seen that? That's a good movie. Jennifer Lawrence is like, she's a very good actress.
Oh, yeah, very much, yeah,
Yeah. And Bradley Cooper was good. They were all good.
I've seen American Hustle, yeah. I saw it in theaters, I just, it was an old.
This is what I got so far.
Yeah, she's pretty good in that one. She played a good part though.
Yeah, work off of this and. I ain't going there, dude. I ain't going I'll bring it donuts too.
Kids go there? What's the name of the kid? Jackson, yeah.
Good lord.
Well, they get those bombers like once a week. Well, you gotta do it. You gotta, you know, try it one time and then.
Since like, at least
Yeah, but they're usually probably juveniles.
That's why I was like, I just wanna take a look at it and see if it's about what we've been doing lately. I looked at like everyone thinks it's all
Well, it's probably a kid saying, oh, we get to get out of school for the day. I mean, that's obvious. Because believe me, if I'd have known that when I was younger, that'd have been done. Me or one of my buddies would have done it.
I don't think they would have cared this year.
It wasn't like I was going to dinosaur school.
Just saying it wasn't as big of a deal back then.
Well, I don't know. If I said the Russians were throwing bombs our way, they'd have freaked out.
Okay, well, that might have gone.
They would just told you under the desk.
And, you know, I had to do that.
Building the desk, and they, you with it.
I'd rather get up and watch the bomb go off. I mean, you know, I'll do that, even though you're gonna die, I'd rather see the bomb. Oh, wow, look at that. You can picture it send or something.
Yeah, before they.
See what's coming your way. And that would be it.
It's nice that you can joke about this, huh?
Going back in the day, my house, I was taking real serious.
Gotta laugh.
What was your first name? I'm trying to recreate it over here and it's not working.
What is this
Yes,
for?
they have
For our next chapter?
don't have
For
that,
Bill?
yes, majority of the time.
This for Bill?
Little babies, they don't anyway, I think it's for like older, older age.
Well, we all ought to sit here and take Bill's test together and figure it out.
I'm still working on the objectives.
Oh, they don't have the test?
You know what?
Check this first.
I'm writing this email. Really? Yes. See, I've only got one of those, and then the commercials come on, your daughter died. Yes. And I was like, see, I got that one, I still got
So
two
you
more
need
doses
to
to
do
get,
the
and
extra.
then it's my
Did they
grandmother.
send to you yet?
That, like, actually had surgical cancer 3 times, come back from that. That's
When's it
yeah.
due, Monday?
Yes. 3
The
different.
objectives?
And so mom,
And
you
get it.
know, wanted to get it, and then we got that one dose, 'cause you have to get 3 different doses.
Oh, really?
So that's
What?
and that one hurt that much less than I know.
And you never know. I know, I've always like,
I don't know what it is
it
about,
always like pops up here, like, you're like,
nobody will go to the bathroom, and the moment,
and we all know.
the time we're doing
That
that,
you
when I walk in.
So you're saying you had to move?
No, I feel awkward cleaning that out in the sink if somebody did it. Like, listen, I really gotta get it done the other day. I'm back there,
I really wanna listen to
I'm
this
or-
story,
no,
like, go
listen,
ahead, tell me.
I'm organizing
Josh did yesterday.
I'm organizing the supplier. Nobody has walked into that bathroom for like 30
You're
years.
probably
No,
the
I'm
source.
not exaggerating. I turn to go walk to the bathroom, somebody walks in front of me, and go, I'm like, every time I go to walk to the bathroom.
Yeah, guys, you go there for people.
Yeah, you should know. You just drove, got 2 nuts. She poured this water, I drink in 2 nuts.
Y'all make sure and send me a copy of your emails that you send to the front end. Make sure you don't have any typos or anything in it.
Seriously?
Well, she said I reviewed it.
She means for those who have.
And then I'm just slacking on the dishes. God, that coffee is killing me.
What?
It smells so good.
Tastes delicious.
Killing me.
So the place where
Air
I'm
number
at,
nine.
the license up there, I'd love to be playing that game too.
Like the Kistler
The
Center?
PT,
Yeah.
I love it.
Really?
So I want to see.
Every Indian, thank you.
Where is it?
Physical therapy place.
The place that I went to, it's Bill's cousin or whatever. He's pretty cool to work with. He's gonna be one of those that, I can already tell like when I take 5 years ago, or whatever it is. Sorry, but he's
Fully.
back. He's gonna be like,
Good, what it is, what happened, what could happen. Yeah,
he moved from the main hospital to
because if it's,
the
This
Valley
says
location,
for
or
assault
CK,
and
or
battery.
inpatient.
because if you don't explain.
He was trying to send me on my own on this one. He's like, yeah, he's like, you see, here's 1, 2, 3. And he said, she's on my CI, so I have to.
I could brighten your day.
That pneumonia that I get, that you can get the vaccine
Yeah.
for or whatever, that's all he had. I mean, he really was just on vision, but never walked, you know, he had oxygen coming out, he had like IV everywhere. It's that subjective, I mean, I got him walked around, but he was like so like, he was like, let me hold my IV pole, and I was like, no, I need to hold all your stuff because I'm scared you're gonna fall, and she was like, no, we're using.
And you went to acute care? Mostly?
Is it like one of those faces? Because I did that to Dad last night.
And then I was like, no, I can't do that.
Crap, I think that's where I'm going. Who are you going?
Yeah, he was like, we're twinsies, we both have
She
on a
owes,
Raider
yeah.
shirt. Photo time, and I was like, do I have to? And he goes, yes. I said, okay, then Mommy,
Just
just wear
for
your face.
CI.
I don't know. It says Shane Abernathy. She's like, he makes.
See, mine's in Chpt, and he has
This is going to where I'm.
especially with you being in high school. Yeah, I was like, "Lucky girl."
Well, it's okay now that you've had clinical, you haven't had your first clinical, like,
everything is censored on its own.
I was watching this movie, and it was in England, and it showed this nurse, right, and she was sitting at her station,
And
and she's working on this patient's file,
she says,
and she's got the computer facing the desk when people walk out. And this woman's sitting there talking, and she goes, "You know that girl? What's going on with her?"
and there's a typo.
I was like, "Man, you can't do that."
Was there, and I was like, everybody else literally at like 8:05,
Yeah.
we're walking in the door. And also he,
Maybe they don't have that law.
Well, I mean, maybe in England,
they're,
it was
they're,
different.
the occupation therapist, old smokers, Jody.
It was, the movie was weird,
Literally
it was about,
graduated last year.
these clones are grown up to a certain age, and then their organs are harvested, right? And you can clone yourself 4 times to extend your life. So, this movie I saw, and it was just, it was sick, man, it was really, I mean, there were still people, but they just treated them like farm animals.
So is that one thing?
The guy that played Spider-Man, the last two Spider-Mans, the guy.
Harry has Stewart, and Walker.
Watching,
Yeah, but usually it's more complicated issues you get on with that. Do they,
They have one tech, and she goes over PTs.
they had 2 in school, so they're kind of, sometimes, a lot of times one of them would go with the female. Or usually 1 or 2 of them would just go before they go, like, ours is sort of in the east and west.
Yeah.
See, and I talked to a girl that, she graduated from Harvard last year, and she's supposed to be working up at Cooper now. But she said that she likes Sparks a lot more because they went as a group to do things where, they split off like, you've got your 16 patients, you do that all by yourself all the time. Where she said it was more like a big group thing.
Yeah.
And it was all that better.
So it's probably worth it.